The topic is BCG vaccine. It is vaccine prophylaxis against tuberculosis. The full form of BCG is Bacillus calmette-guerin vaccine. BCG vaccine was developed by Calmette and Guerin in 1921. So Calmette and Guerin, they developed this vaccine. BCG strain. In India, WHO recommended Danish 1331 strain of BCG is used. So Danish 1331 strain is used in India and it is recommended by WHO. This vaccine is prepared in Central BCG Laboratory, which is in Gyundi, China. The Central BCG Laboratory is in Chennai. Reconstitution of BCG. BCG is available in lyophilized form. BCG is available in lyophilized form. It should be reconstituted before administration. It is available in lyophilized form and it should be reconstituted before administration, and the reconstitution is done by using normal saline as diluent. Distilled water is never used as it is irritant. Once reconstituted, it has to be administered within 1 hour. So for reconstitution we use normal saline. We do not use distilled water for reconstitution because distilled water is irritant, and once it is reconstituted within 1 hour we have to administer it. Administration of the vaccine: 0.1 milliliter, that is 0.1 milligram TU of BCG vaccine is administered above the insertion of left deltoid by intradermal route using a 26 gauge tuberculin syringe. 0.1 milliliter of BCG vaccine is administered above the insertion of left deltoid, and the route of administration of BCG vaccine is intradermal. It is done by using a 26 gauge tuberculin syringe. Phenomena after BCG. If BCG is properly injected intradermally, then the following phenomena develop at the inoculation site. After 2 to 3 weeks, papule develops. 5 to 6 weeks, shallow ulcer develops, which is covered with crust. 6 to 12 weeks, permanent tiny round scar is formed, which is 4 to 8 millimeter in diameter. 8 to 14 weeks, Montauk's test becomes positive. If overdose is given, the lesion or scar becomes larger and irregular in size. So when BCG is properly injected intradermally, 2 से 3 वीक के बाद papule will develop. 5 से 6 वीक के बाद ulcer is developed, which is covered with crust. 6 से 12 वीक में permanent tiny round scar, which is 4 to 8 millimeter in diameter is formed. और 8 से 14 वीक में Montauk's टेस्ट पॉजिटिव हो जाता है, एक परमानेंट टाइनी राउंड स्कार बनता है एंड Montauk's टेस्ट इज़ पॉजिटिव विदिन 8 to 14 वीक्स. और अगर ओवरडोज हो जाता है तो जो लीशन है वो लार्ज और इरेगुलर हो जाता है. प्रोटेक्शन. Efficacy. Many trials have shown that BCG has variable efficacy of 0 to 80%. Efficacy 0 to 80%. Duration of immunity lasts only 15 to 20 years. So duration of immunity is 15 to 20 years only. Though BCG may not protect from the risk of tuberculosis infection, it surely gives protection to infants and young children against the development of complications such as tuberculous meningitis and disseminated tuberculosis. So efficacy is 0 to 18%, duration 15 to 20 years. BCG may not protect from the risk of tuberculosis infection, but it surely gives protection to infants and young children against the development of complications such as tuberculous meningitis and disseminated tuberculosis. So BCG, it gives protection against tuberculous meningitis and disseminated tuberculosis, which are the complications of TB. Complications following BCG. Most common complications include ulceration at the vaccination site and regional lymphadenitis. So most common complication is ulceration and regional lymphadenitis. Rarely keloid or lupus lesion and osteomyelitis may develop. Keloid or lupus lesion and osteomyelitis, these are rare complications. Very rarely non-fatal meningitis, progressive tuberculosis and disseminated BCG infection, that is BCGitis, are reported in people with low immunity. C. Keloid or lupus lesion and osteomyelitis were the rare complication, and very rare complication are non-fatal meningitis, progressive tuberculosis and disseminated BCG infection, that is BCGitis, and these are reported in people with low immunity. Indications of BCG. Direct BCG. BCG is directly given to the newborn soon after birth. So it is given soon after birth. This strategy is followed by most of the developing countries, including India. If not given at birth, it can be given later, maximum up to 2 years. So direct BCG can be given maximum up to 2 years. Indirect BCG is given after performing tuberculin test. Direct BCG soon after birth, maximum up to 2 years, and indirect BCG is given after performing the tuberculin skin test. Contraindications to BCG include HIV positive child, child born to AFB positive mother, child with low immunity, generalized eczema and pregnancy. So these are the contraindications of BCG vaccines. It is not given in HIV positive child. It is not given to a child born to AFB positive mother, not given to a child with low immunity, and generalized eczema and pregnancy. प्रेगनेंसी में नहीं देते, जनरलाइज्ड एक्जिमा में नहीं देते, चिल्ड्रन विथ लो इम्यूनिटी में नहीं देते, इफ़ अ चाइल्ड इज़ बॉर्न टू AFB पॉजिटिव मदर तब नहीं देते. अदर यूसेस ऑफ BCG वैक्सीन आर BCG includes non-specific stimulation of the immune system, and thus it provides some protection against certain diseases such as leprosy and leukemia. So BCG includes non-specific stimulation of the immune system and provides protection against some diseases like leprosy and leukemia. BCG provides protection against certain diseases like leprosy and leukemia. BCG has been tried as an adjunctive therapy in malignancies such as bladder carcinoma. So BCG vaccine is also used as an adjunctive therapy in bladder carcinoma, onco-TICE strain of BCG. VPN 1002, it is recombinant BCG vaccine. VPM 1002 is a recombinant BCG vaccine under phase 2 trial. It is prepared by replacing the urease C encoding gene from Listeria monocytogenes, which improves immunogenicity, and it promotes phagolysosome fusion. So VPM 1002 is a recombinant BCG vaccine under phase 2 trial. It is prepared by replacing urease C encoding gene from Listeria monocytogenes, which improves immunogenicity.